The 74-year-old singer said that a fall on a hard surface in late summer left him in considerable pain and discomfort and, as a consequence, his farewell Yellow Brick Road tour has been postponed. In a post on Twitter announcing the postponement of his concerts in Britain and the US, the Crocodile Rock singer said that he has been advised to have an operation as soon as possible to ensure that there are no long-term complications. Despite the singer's involvement in intensive physio and specialist treatment, the singer revealed that the pain has continued to get worse, leading him to have difficulties moving. Without full mobility, the singer is unable to perform and therefore, the Mammoth Tour has been rescheduled in Europe and the UK to 2023. Johns Hopkins Medicine explained that the hip area on each side of the pelvis is made up of three sections, the ilium, pubis and ischium. Together all three bones create the hip joint, which is a ball and socket joint, that allows motion and gives stability needed to bear the body's weight. This is a breaking news story with more to follow. Because this socket bears your body weight, pain in this area may be caused by injury to muscles, tendons or small fluid-filled sacs that cushion and lubricate joints. When falling on your hip like Elton, there is an extreme risk of serious damage including hip fracture. The Mayo Clinic describes hip fracture as life-threatening and the risk only increases with age as bone density and muscle mass decreases. Although Elton has not revealed specifically what sort of injury he has encountered on his hip, the 5 most common hip problems caused by a slip and fall include the following: strains, sprains, and tears. The ligaments, tendons, or muscles surrounding the hip could become strained, sprained, or torn from the impact of a slip and fall. Symptoms can include pain, weakness, and swelling of the hip area. Dislocation. This occurs when the ball at the top of the femur slips out of the socket. It causes extreme pain and the injured victim will not be able to move his leg. If the nerves surrounding the area are damaged, the person may lose feeling in his ankle and foot too. Fracture. This can be a partial or complete fracture of the femur, or thigh bone. A femoral neck fracture is a break 1 to 2 inches from the hip joint and may cut off the blood supply to the femur head. An intertrochanteric hip fracture occurs 3 to 4 inches from the hip joint. It doesn't cut off the blood supply to the femur head and is considered less dangerous than a femoral fracture. Almost all fractures of the femur will require surgery, often including permanent installation of metal plates or screws to hold the fractured bone in place. Bursitis, swelling of the fluid-filled sacs surrounding the hip joint. It causes aches and pains in the hip and on the outside of the thigh. Walking and other movements of the hip and leg can aggravate the problem. Labral tear. This is damage to the cartilage surrounding the socket of the pelvis. It is commonly caused by slip and fall accidents when a joint is twisted. If individuals do suffer from a hip fracture, it can completely reduce your independence. The Mayo Clinic reveals that about half of the people who have a hip fracture are not able to regain the ability to live independently. Complications with long-term hip fractures include blood clots, bed sores, pneumonia and further loss of muscle mass. Therefore, if you have experienced significant trauma such as a fall from a great height, or a direct blow to the hip, it is important to speak to a healthcare professional. Treating hip injuries depends on how severe the condition is. For hip fractures, surgery is always nearly needed and can involve a total hip replacement if the break is severe enough. Rehabilitation after surgery is crucially important and may involve physical therapy, as this involves a range of motion and strengthening exercises. After a hip injury, it is essential to get some rest in the first 24 to 48 hours, but then start to move it gently every hour you are awake. After 48 hours, and if the injury is not as severe as a fracture or break, you should try to slowly return to normal activity. Elton is set to have surgery on his hip after featuring at the charitable Global Citizen event on September 25, 2021.